This is Angie Fabian with Summit Healthcare. Some of you may have heard that people who've had COVID-19, whether hospitalized or not, are suffering with long-term effects of having COVID-19. Today we have a very special guest, Kim O'Farrell, who's going to talk with us about the effects that she is having after suffering COVID-19. Hi, Kim.
Hi, Angie. How are you?
I'm good. How are you?
Good, thanks.
Good. Can you introduce yourself, tell the community a little bit about yourself and
Sure.
who you are?
Sure. Like you said, my name is Kim O'Farrell.
Mm-hmm.
I work with the Navajo County Public Health Emergency Preparedness Division. I've been in the community about 8 years now and love what I do. I have a little guy that goes to school in the area, and my husband works in public safety in the area as well.
Nice. And Kim, Summit in Navajo County and all the fire stations partner every year, and we give out the massive flu shots.
Yes.
I like to call them the drive-bys, but they are drive-throughs. But we give them out in almost every community. We do a drive-by flu shot. Yes,
we do. Yeah.
Good.
Yeah.
We enjoy that partnership. Thank you.
We do too. Thank you.
Okay, so tell me about, when did you get COVID? When did you first know you had COVID?
So I tested positive last March 27th.
Okay.
So almost a year ago now.
Mm-hmm.
And continued to test positive for 73 days after that. So
that's a lot.
It's been a long year.
What has your experience been like once you found out you had COVID? What kind of symptoms were you having?
So it started out with I was at work and I was just feeling off, and I had abdominal issues, and I was just I kept dropping things and spilling things, and Friday of that week I realized that I was standing at the copy machine and I couldn't figure out how to work it, and that Friday I went home with the most horrible body aches I've ever had, and Saturday I woke up and I just was not feeling good.
Mm-hmm.
Stiff neck, headache, just feeling like crap, basically.
Mm-hmm.
And the weeks went on, or the days went on, and I was so tired. The body aches continued. I didn't ever get a fever, and I didn't have a cough. It just felt like a really, really horrible flu. But as the days turned into weeks, I found that I couldn't walk across my living room. I could get from my chair to the bathroom, which is, I don't know, 10 feet maybe, and I was completely winded. Just really continued to feel bad. My cough developed then, and I was coughing so hard I was vomiting, and just really continued to have difficulty breathing. I started noticing that I wasn't able to complete sentences, and my thought processes just weren't intact. So this continued for weeks and weeks and weeks. There were a couple of days that I legitimately thought I was going to die. Couldn't get out of bed. Still no fever, but those horrible, horrible body aches went on for weeks. The breathing went on for weeks. I tried all kinds of breathing treatments and different treatments, and nothing was helping. Okay. Interestingly, my husband also tested positive, and he was up painting the house and getting around and doing different things, and I just kind of laid there and watched him, but he was able to carry on. He didn't feel good. He wasn't himself, but it was just interesting to contrast the symptomology in our own house.
Mm-hmm. Two different symptoms,
yeah.
Sets of symptoms. And you were not hospitalized during that time?
I wasn't. I probably should have been, just given my level of breathing or not breathing, if you will.
Yeah. some people have been hearing about people who suffer from COVID, the long-term effects.
Yes.
What are some of your long-term effects?
So I do still have difficulty breathing.
Mm-hmm.
My voice comes and it goes.
Mm-hmm.
I lay down. I wheeze horribly. I still will have those coughing fits to the point where I vomit.
Mm-hmm.
But now I have heart failure. I'm in heart failure. My blood pressure is it's never been high ever in my life. I've never had any health issues, but now my blood pressure is not controlled. Um, I had my blood drawn, and it was interesting because it was black and really thick, and so that's changed. I have just the strangest things. Both my husband and I we've experienced this since COVID, and it's happened to us both.
Mm-hmm.
And we'll be sleeping, and our throats close, and we can't breathe. And we get up, and we know that we're breathing because there's a sound coming out,
Mm-hmm.
but our throats are closed, and it takes some time to calm down so that it will reopen that airway. So that's been interesting, both when you're asleep and when you're awake. But the heart failure, that's the biggest thing. Very scary.
Mm-hmm.
I don't know what this is going to look like in a year, in 5 years, 10 years down the road. So we'll just keep monitoring that and taking care of business as we need to.
Yes.
I've had to change my diet. There's no salt, no none of the fun stuff anymore. But we're learning, and we're processing through that. Trying to figure out a new normal for us. But life is different now, for sure.
What would you tell someone who thinks catching COVID is not a big deal or something to worry about?
That's a great question. In the beginning, I remember sitting at work, and one of my coworkers said, "Kim, are you afraid of COVID?" And I said to her, "No, I'm not. It looks like it's maybe a flu type thing, and I'm really not afraid because we were working and carrying on supporting the community, and so I was meeting with a lot of different people, and then I got sick, and reality hit. When they gave me the test results of my heart, that's really the tell-all there. And the stories of other folks in the community that I've heard about, and their struggles, and their long-term struggles, and they're going to be life struggles, as are mine. So I would say, take it seriously. Take it seriously. We're hearing in the health department that people weren't taking it seriously, and then something very major impacted one of their family members. And now they're clamoring, how do we get vaccinated? What do we need to do to take care of this? Because we didn't take it seriously. This is a very, very serious illness, and we don't know how it's going to impact us. Like I said, my husband was able to function and do different things, and he recovered, rather quickly as compared to me. But he has different problems too, and so he has lasting impacts. But we just don't know. And the big thing is not only our health and our lives as we once knew them, but it's the monetary side of things. My bills are big, big, and I've had a lot of tests done, and I will continue to have tests. There's a lot of different things that we may not necessarily think about through this, but it's important to really take those precautions and make sure that you're staying home when you're not feeling well, that you're wearing your mask, that you're washing your hands and doing the right thing.
Mm-hmm. Absolutely. And we say that consistently throughout the
Consistently,
community. Yep.
yes. This isn't just an impact on you.
Mm-hmm.
This is a ripple effect, and I'm seeing that, as I don't share my story a lot. I keep it pretty private, but those who do know, I see that it even affects them, even out further than I thought it would. So it's really, really important, not only for yourself, but for your family to really take those precautions.
Absolutely. Absolutely. Thank you, Kim. Is there anything else you want to add?
I just really appreciate all of the support that I've gotten, and the opportunity to share my story, and if it affects one person, then I feel like I've done my job, and if it makes somebody understand that this really is a serious illness, then I've done my job.
Good. Thank you. Thank you for sharing your story. I just want to say that it is a prolonged effect, but after COVID, you may have symptoms, you may not. But do take it seriously. Continue to wear your mask in public, wash your hands, stay home if you're sick, think about others. Kim had brought up getting your vaccination. So you can go to summithealthcare.net, click on the big red banner, and it'll take you right to where you can schedule your vaccination, or you can go to Navajo County Public Health website and go and schedule a vaccination through there. If you need help scheduling, the Recenter and the Sholo Public Library and Pine Top Lakeside Public Library are helping people register for their vaccinations. Right now in the Navajo County, we are giving Moderna vaccine, so that's a 2-dose, and Johnson & Johnson, which is a 1-dose. So if you have any questions, feel free to go to the summithealthcare.net website and go click on the big red banner, and there's a phone number that you can call. Thank you.
I would like to also add that the Snowflake Taylor Library is also assisting folks with registration, as well as the senior centers in our area.
Good. Thank you very much.
You're welcome.
That's it for today. I'll talk to you soon.